James is here with us, fully recovered with his surgeon, Dr. Brian Boxer-Walkler, also known as Dr. Brian to his patients. And before we get into this, pretty intense footage there. I want to show everyone a before and after. So smile into that camera. We're going to pull up your before picture and do a little side-by-side because I'm seeing some sparkling white eyes there. You've obviously looked in the mirror.
Of course.
What do you think?
I mean, like night and day. I can't believe the transformation. I couldn't even have hoped for what I got.
Dr. Brian, let's talk, number one, what causes bloodshot eyes?
Well, the short answer is that it's years and years of sun damage. What happens is that when people are kids playing around outside, nobody's really wearing sunglasses because parents never think about protecting their kids' eyes from the sun. Now, of course, they think about protecting their skin, and they lather their kids up in sunscreen, but sunglasses, no. So what happens is then this habit of not wearing sunglasses continues into the teenage years and then into adulthood. And unfortunately, the result of all this cumulative sun damage is red eyes, yellow spots on the eyes, and also brown and dark stained looking eyes.
And parents, the $1 sunglasses that don't provide UV protection, those aren't the ones you want to put on your kids, right?
I really talk to patients that have kids and say, explain to your kids that they have to wear sunglasses even at a young age, even at toddler age, because that is where they learn those habits of wearing sunglasses. And believe me, they're going to resist wanting to put something on their face. My kids did the same, but you got to stick with it as a parent because your kids will thank you years later.
And really quickly, just over and over using the eye drops is not a good thing because those are designed to constrict your blood vessels. They can cause rebound, make it worse. So how does this procedure work? Because we got our supersized eye over there to show everyone how the procedure works.
And I got a little scared looking at this for the first time.
It's a scary looking eye.
So essentially the procedure is quite elegant in its simple form. It's about 15 minutes per eye. And we use numbing drops, so people don't have to go under general anesthesia for this. And there's 3 steps. So the first step is I'll map out by marking the membrane where the sun damage is. And then the second step is I'll delicately peel off the membrane like this. And then what happens is the body, as a third step, will regenerate a brand new membrane all by itself to cover that area. And that occurs over about a month.
So it's okay to take that off, that membrane off that's causing the bloodshot eyes, and no ill effects going forward here for James other than bright white eyes?
Yeah, he's had a very wonderful post-op recovery period, and he looks great, and continuing to go forward, it's just going to get even better from where he's at right now.
And I can't emphasize enough, this is not for someone who wakes up one day and you have bloodshot eyes because you're tired, because you did have one too many last night. This is for someone like James who suffered from a lifetime of this due to sun damage. You look great.
Thank you
so
very much.
glad you could share your story. Dr. Brian, thank you for being on the show.
Yeah.